Hello students, in this video I am going to discuss about the previous MCQs asked in the Madhya Pradesh University. Clear? So in this session I will discuss the paper 1 and paper 2 MCQs which were there in the session 2025. So what are the questions we have? So question 1 is, what type of joint is first chondroesternal joint? So what do you mean by this first chondroesternal joint? Now dear students, when we are talking about any chest cavity joints, now this is your manubrium and here you will have the first joint. Now this is your costal cartilage and these are the joints which are known as chondroesternal joint. Now when we are talking about the first chondroesternal joint, it is a type of primary cartilaginous joint. Now this question has been asked because the remaining costal cartilage and sternal joints all are synovial. Clear? So you have to keep this thing in mind. It is particularly talking about the first chondroesternal joint and it is a answer is C, it is a primary cartilaginous joint. It is not a secondary cartilaginous joint. Secondary cartilaginous joints are the midline joints. It is, if you are talking about the synovial joint, then it should not be the first. The second, third and fourth joint between the sternum and the costal cartilage are synovial. So answer of this question is primary cartilaginous. Second question is, all are the Horner signs symptoms except, so which is not a feature of Horner syndrome. So you know that Horner syndrome occurs when there is involvement of the T1 root. So which is not a feature? Ptosis is there, meiosis is there, anhydrosis is there, but exophthalmos is not there. Why? Because it is a shrunkening of eye, that means anophthalmos, not exophthalmos. Now we will move to the third question, where are the Purkinje cells present? Dear students, Purkinje cells are the neurons which are the special feature of the layers of cerebellum. You know cerebellum is having three layers, outer molecular, middle Purkinje and inner granular cell layer. So where is the cerebellum? Answer D is there. Now the next question is, which structure forms anterior boundary of oblique pericardial sinus? Now dear students, when you will have the sinuses of pericardium, you know that there are two sinuses, transverse sinus and oblique sinus. Oblique sinus lies behind the base of heart. So what do you mean by the base of heart? Base of heart means it is formed by the left atrial chamber. So left atrium, but obviously going to form the anterior boundary. So where is the left atrium? Answer B. It is left atrium. Now most of the superolateral surface of cerebral hemisphere is supplied by. So when you will see the cerebral hemisphere, this is known as superolateral surface and this surface is supplied by middle cerebral artery. Clear? So when you will have anterior cerebral, dear students, anterior cerebral supply most of the medial surface. Middle cerebral, it is the answer, it supplies the superolateral surface. The posterior cerebral mainly supply the inferior surface of temporal lobe and occipital lobe area. So answer B is there. A knife has penetrated into the deltopectoral groove. Which one of the following structure is involved? Basilic vein, cephalic vein, axillary vein, subclavian vein. Now dear students, you know that there are two subcutaneous veins in the upper limb and when you will see the cephalic vein, it is having a longer course and when you will see near the termination of the cephalic vein, it passes through the deltopectoral groove, then it pierces the clavipectoral fascia and finally terminates into the axillary vein. So when there is an injury into the deltopectoral groove, you are going to injure the cephalic vein, so answer B is there. Now the next question is, which nerve carrying the secretomotor fiber for parotid gland is? So dear students, when you are talking about the parasympathetic supply, that is secretomotor fibers of parotid gland, you know that for the parotid gland, preganglionic parasympathetic fibers comes along with the glossopharyngeal nerve and with the help of lesser petrosal nerve, they will reach to the aortic ganglia. But in this question, there is nothing like pre and post ganglionic. So when you will see the options, it is auriculotemporal nerve, great auricular, zygomaticotemporal, posterior auricular. That means we are having all the four post ganglionic nerves. So which is the post ganglionic nerve? Answer is auriculotemporal. It is going to supply the parotid gland. Now secondary villi of placenta include all except. Now here you have to keep this thing in mind that there are three sets of the villi: primary, secondary and tertiary. So when the primary villi is there, it is formed by cytotrophoblast and syncytiotrophoblast. Now when the primary villi is having the central placed mesoderm, then it is going to form your secondary villi. That means the mesoderm, cytotrophoblast and syncytiotrophoblast, all the three are part of secondary villi except fetal capillary. So fetal capillary is not the part of secondary villi. If fetal capillary is present, then it should be the tertiary villi. Now the next question is the main content of quadrangular spaces. Dear student, when you will have the spaces around the scapula, you will have the three spaces. Now quadrangular space is having the axillary nerve along with posterior circumflex humeral artery. So where is the axillary nerve? Answer A is there. It is the axillary nerve. Now the last question of this paper is all are the tributaries of superior vena cava except. So what are the options? Right brachiocephalic vein, left brachiocephalic vein, hemiazygous vein and azygous vein. So which is not the tributary of superior vena cava? You all know that hemiazygous vein does not open into the superior vena cava, it opens into the azygous vein which further open into the SVC. So answer C, hemiazygous vein is not a tributary of superior vena cava. Clear? Now we will move to the paper second. Now this is the paper second of September 2025 in Madhya Pradesh University exam. So let's see its 10 MCQs. Now here what is the question 1? The question 1 is that which muscle is called as peripheral heart. Now dear students, you all know that the soleus is having a venous pump action and its contraction pushes the blood towards the heart. That's why it is known as peripheral heart. So where is the soleus? Answer A is there. Transpyloric plane passes through all of the following structure except. So dear students, this question comes from the abdomen, and when you will have the transpyloric plane, you have to keep in mind that it passes from the L1 vertebrae, it passes through the pylorus of stomach, it passes through the neck of pancreas, but not from the tip of 10th rib. So answer C. Now the next question is the root of mesentery cross all the following structures except. Now dear students, the root of mesentery always crosses obliquely. So when you will see the attachment of this root, you have to understand that this root starts from the left side of midline and goes towards the right sacroiliac joint. So this is a oblique course of the root, and when it is going from left to right, it crosses more of the right structures rather than the left structure. So what are the options? So root of mesentery crosses all except abdominal aorta. Yes, it crosses the aorta, it crosses the IVC, it crosses the right ureter, but it does not crosses the splenic artery because the splenic artery is very higher and it is a branch of celiac trunk which never come in contact with the root of mesentery. Now we will have the next question that spleen develops in. Now spleen develops in, what are the options? Dorsal mesentery, ventral mesogastrium, lesser omentum and mesentery. Now dear students, you have to keep this thing in mind that when we are talking about the development of the spleen, you know that there is a formation of the two folds anterior and posteriorly into the foregut. Now anterior is known as ventral mesentery or ventral mesogastrium and posteriorly is known as dorsal mesogastrium. In the dorsal mesogastrium, there is a formation of a spleen, and because of this, you will have the formation of two ligaments. One is known as gastrosplenic, another is splenorenal. So where is the answer? Answer is dorsal mesentery. Now following are the content of ischioanal fossa except. So ischioanal fossa is a fossa which is present on both the side of anal canal into the perineum. So what are the options? Inferior rectal vessels, yes, they are present into the fossa. Pudendal nerve is present, yes, it is present into the lateral wall of the fossa. Ischioanal pad of fat, yes, fat is a main content of the fossa, but middle rectal vessels are not present into the fossa. These are the branches of your internal iliac artery and they are present into the pelvis, not into the ischioanal fossa. The next question is which of the following is not a content of broad ligament? So which of the following is not a content of broad ligament? Means that you should know that broad ligament is a double layer of peritoneum which is present along the lateral side of uterus. Now what are the options? Cervix, uterine tube, ligament of ovary and round ligament. Now dear students, this cervix cannot be the part of broad ligament because you know cervix is the lower part of uterus itself. So it is not the part of your broad ligament. So answer A is there. Remaining all three are seen into the broad ligament. The next question is muscles of first layer of sole are all except. So what are the options? Abductor hallucis, flexor digitorum brevis, abductor digiti minimi, extensor digitorum brevis. Now dear students, by seeing the four options, you can even correct this question without knowing the layer, because you have to understand that extensor muscles are present on the dorsum of foot, not on the plantar surface of foot. And when you are having the layers of the sole, you are talking about the plantar surface. So by having this knowledge only, you can say that D is the wrong answer, because extensor digitorum brevis present on the dorsum of foot and we are dealing with the sole. That means we are dealing with the plantar surface. So answer D is wrong. It is not the part of sole. Now abduction, adduction of forefoot take place at which of the following joint? Now dear students, when we are talking about the movement of the forefoot, the adduction, abduction, they are taking place with the subtalar joints. So where is the answer? Answer is C, subtalar joint. Keep this thing in mind that ankle joint is a classical hinge joint. It does not causes inversion, eversion or adduction, abduction. Ankle joint causes only plantar flexion and dorsiflexion. Cystic artery is a branch of hepatic artery, left hepatic, celiac trunk, common hepatic. Now this cystic artery arises into the Calot's triangle and it is a direct branch of right hepatic artery. The last question of this paper is superior rectal artery is a branch or continuation of. So dear students, it is a direct knowledge based question that superior rectal artery is a continuation of inferior mesenteric artery. So answer B is there. So dear students, by this we have finished the 20 MCQs which has been asked into the Madhya Pradesh University exam in September 2025. So this is all for the session. Thank you and bye bye.